You guys, I can't believe this is medicine, but this past week, I did a breast reduction on a patient on Monday. And anytime I do a breast reduction, I always send every piece of skin or breast tissue off to a pathologist. And the reason that I do that is because they will examine the tissue underneath the microscope and make sure the cells look healthy. All of our patients who are 40 years older or anyone with a genetic predisposition gets a mammogram before the procedure. So we do the mammogram before, and then we send the tissue off after surgery. And on Friday, my nurse practitioner calls me and says, this patient has bilateral breast cancer, which is really, really rare. This has probably happened to me maybe 2 or 3 times in all the years that I've been doing this type of surgery. So I said, okay, give me your cell phone, I'll call her. So I'm in a taxi heading from our Manhattan office to the ferry back to New Jersey. And I call her and I say to her, I'm like, it's Dr. Parcell. I just wanted to review the results of your pathology. And she says to me, I already know the results. And I said to her, how do you already know the results? Like, we just got these in, like the pathologist just called my office like 15 minutes ago. And it's a Friday afternoon. So like, we're wrapping things up for the weekend. And she's like, yeah, I got an alert. It came through my portal. So I looked at it and it shows that I have breast cancer. She was like very calm on the phone. I was not so calm because I can't believe in 2025 that patients have access to this type of information without physician counseling. I cannot imagine being in her position, receiving this news on like a Friday afternoon. Sometimes it'll come through on a Saturday or Sunday, and not having this interpreted or being accessible, having any sort of access to a physician or someone that can help me interpret this, potentially calm me down if I had a diagnosis like this. I just think this is wild that hospital systems allow this type of information to just directly go to the patient without any sort of interpretation. Now I can see the flip side where like you're waiting and waiting and waiting for something and it's frustrating because you just want to get the information, but there has to be some sort of happy medium, because it's terrifying to me that patients are getting crazy diagnoses just through the internet without like a caring, compassionate provider to walk them through exactly what it is, counsel them, and then set them up for next steps and reassure them. So please let me know if you have had a similar experience and if your hospital or surgery facility has like done anything to change this, because it's alarming and I find it like disappointing as a doctor that like this is going on.